Hello.
We are here with Dr. Alan Shoopak, President and Original Doctor with Orthodontic Specialist of Florida. Welcome, Dr. Shoopak.
Hey, how are you?
We just want to ask you a few questions. Let's start a little bit about your background. Where are you from originally?
I am originally from New York, a city right outside New York City.
And what brought you down to Florida?
Well, I went to school at the University of Tampa. I originally wanted to be a marine biologist, and University of Tampa had a great program for that.
Okay, so how the switch from marine biology into orthodontics? How did that happen?
Well, growing up, my dad was an auto mechanic, and I watched him for many years, repairing cars, using his hands, and I like fixing things too. So after I got a taste of the marine biology, I said, I really want to go back to doing something with my hands. And I like people as well. So I combined both using my hands and people, and I found that dentistry was the answer. I went to dental school, and then I learned that this mechanical part of orthodontics was really intriguing. From there, I became an orthodontist.
Interesting. Well, let's talk about the group as a whole a little bit. Tell us some of the most important principles for Orthodontic Specialist of Florida.
Well, for over 30 years, I've been trying to make braces affordable. And what I mean by that is traditionally, there is a down payment associated with getting braces on. I've learned that there was a big section or sector of our population that really couldn't afford braces and didn't think they could get them. So what I decided to do is set up a program where patients can come in and get braces on with no down payment and affordable monthly payments. This allowed just about everybody to get braces.
Great. And certainly a lot of people have gotten braces, and it's expanded to where we now have 30 plus offices in the system. And obviously you can't see all those patients by yourself, so you have to affiliate with some high quality doctors to do that. What do you look for in a doctor that joins the group?
That's a good question. I look for about three things, three big things. First, of course, they need to have a significant orthodontic acumen. They need to be very versed in orthodontics. Secondly, I look for a very caring and upbeat personality. But thirdly, and most importantly, I look for a doctor that's going to treat every patient as if it was their own family member.
Important things all. So when a patient comes into the offices, what are some of the most important things for them to look for, and what should they expect from our group?
Well, our staff is trained and educated to service our patients' needs. Everything from the financial end to the appointment scheduling to treatment itself. Our goal is to make that as pleasing an experience as possible. We strive to make the relationship with our patients very important.
Okay. And when they start treatment, what kinds of things should they expect from their treatment?
Well, everybody's a little different. Orthodontics is not the same for everyone, but the idea generally is that they should expect to be in braces for about 2 years on average, and they come in every 4 to 6 weeks for adjustments. 20 minutes to 40 minutes once every 4 to 6 weeks. And at the end of treatment, once everything's nice and straight and they're happy with the results, we'll make retainers for them, which are holding appliances that keep things nice and straight.
Okay, good. So braces into appliances and retainers, and then out with a beautiful smile.
That's exactly it.
Got it. Okay, now we'd like to play a little game called Some People Ask. And these are questions that people ask primarily on social media, but on other mediums too, about treatment. So what we get from a lot of patients is, what if I haven't had a cleaning yet? Can I start orthodontic treatment?
Yes, we actually ask patients to come in and have a consultation with our doctor, even if they haven't had the opportunity to get the cleaning or see a dentist yet. Many times we can do some treatment for them in lieu of having their cleaning done, or at least we can recommend what might be necessary for their dental needs.
And what about cavities?
There are times where patients present with some dental needs. We have to assess that, and a lot of times we can actually do braces and work around whatever they might need. But the best thing is to have the patient come in and let the doctor examine them, and they can then figure out what the best course of action would be.
Okay. And wisdom teeth, can we start with those?
Well, wisdom teeth, it's an interesting question. What we do initially is we have our patients come in and we take x-rays and take a look at these films, and we assess not only, of course, what might be needed from the braces standpoint, but the wisdom teeth. Most often, if not all the time, wisdom teeth don't have to be managed before braces. A lot of times we then review the position of the wisdom teeth once the braces are completed and the patient's in retainers, and we can make an assessment at that point if they have to be removed or if not.
Okay. What will I need to get teeth pulled?
Everybody's a little different. It's a good question because that's one of the questions we get almost all the time. Today, one of our goals in orthodontics is to try to avoid pulling teeth. And if we have the ability to do that, we will. But sometimes there's cases where there's just so much crowding, so much overlapping of the teeth that we can't create the room we need with just simply braces, and we have to have teeth removed. Again, speaking to the orthodontist at the initial consultation, we'll be able to determine if we can make the room we need or if teeth need to be removed. But not everybody needs teeth removed.
Okay. And this is a question we get a lot. When I start treatment, will I get both the top and bottom braces put on? And if not, why?
A lot of times we have to be cognizant of the way the teeth come together. When the upper teeth overlap the lower teeth a lot, it's called an overbite. And we know that if we try to put the upper braces and the lower braces on at the same time, that might interfere with them closing their teeth together, the patient's teeth together. So what we'll do is we'll put the upper braces on initially, create a little bit of room between the upper and lower teeth, maybe 2 or 3 months, and then we'll get on and put the braces on the bottom teeth. This doesn't extend treatment time at all, but it does make it a little more comfortable for the patient.
Okay. And that's the end of Some People Ask. Dr. Shoopak, thank you very much for your time today.
You got it, buddy. Appreciate it.